So when COVID hit, unfortunately, we're an outpatient center, and we did throttle back extremely on our treatments at that point, obviously, because of COVID, social distancing, and being unaware of what was going on. So during that time, some of the research that came out, you could see kind of almost a projected fallout that was going to come from these patients, and how many, especially in New York, with how many patients were hospitalized at that time and how overwhelming it was becoming, to understand that there was going to be a long-term sequelae from these things. And one of the main things that's difficult about COVID is it is a lung disease at its root, and that's where a lot of the clinical manifestations come out of. So when we're breathing, those are not typically muscles that we use on cue to help us breathe in and breathe out. They're autonomic muscles. They happen without thinking. But there's ways to train them to work more efficiently and to work and to get stronger, so to speak. Each patient is screened out, both their musculoskeletal, their cardiovascular system, and their just general quality of life through both outcome measures and through a 6-minute walk test, which is a cardiopulmonary functional baseline that we use to gauge how these patients are at evaluation, and then how they are throughout the treatments and then through discharge. So looking at both their endurance and their heart rate and their oxygen saturation throughout the program, and then developing a program based off of those things if there's any deficiencies within those baselines that we see, and then incorporating, again, the breathing exercises into those regular exercises once they learn them. Part of it as well is about energy conservation and management, and then understanding both what fatigues you and then what your borderlines are. So the big concern about this population are the people who are called your silent hypoxias. So the people who are getting low oxygen saturation without getting dyspnea, shortness of breath, very quickly. So they'll exercise and we'll do the 6-minute walk test, and they won't be complaining about shortness of breath, but their oxygen level is going down. And then before you know it, they're starting to fatigue, not realizing why, and it's because their body's not processing the oxygen correctly. So part of it is learning both self-monitoring, understanding the symptoms of what hypoxia is, and then understanding not to push through those boundaries. Yes, typical early intervention is better, but it can facilitate at any point that you feel ready and feel comfortable. And that's the biggest thing, is that you need to get out of your house and you need to start moving around a little bit. So actually, you're doing us a help by going out and seeking care, because now we have more information about more people and more data as we go along as well. So the more people we get involved in these programs, the more we understand and the more we're able to study too.